Good evening, this is Melissa Worthy for Class 104, Module 8, Medication Administration. We are to give patient Millie Larson, date of birth 1/1/1936, 2 meds. The meds to be given are furosemide, 20 milligrams IV push over 2 minutes. We're also supposed to give insulin Lispro 10 units subcutaneously, and this is for blood sugar, and the furosemide is for blood pressure. Miss Millie Larson is to get the meds today, so let's gather our meds. The first med we have is furosemide, 100 milligrams. All right, so we have 10 milligrams per ml. The order is for 20 milligrams, so we will be getting 2 mLs of this. 2 mLs of the furosemide. The expiration date on this is 10/20/29. We have our syringe, which is a 3 cc syringe. We have our needle to draw it up. The needle is a 23 gauge, 1 inch. The expiration date is 11/30/2025. We're going to give this via IV. The next med is going to be Lispro, which is for her blood sugar. And we have insulin Lispro here. We have 10 mLs. We are supposed to give 10 units. The expiration date on this is 10 October 2027. We have an insulin syringe here. It is a 29 gauge, and it's a 3/16. The expiration date for this is 7/31/2024. So those are the 2 meds that we're going to give. All right, verified. All right, Miss Millie Larson, according to the MAR, she doesn't have any known allergies. So then I will go to the room. All right. All right, knock on the door. Good evening, Mrs. Larson. My name is Melissa Worthy. I'll be your nurse for today. The doctor has ordered for you to get 2 meds. 1 med is furosemide. It is 20 milligrams. That's only given through your IV catheter. He wants you to get that now for your blood pressure, and you're also going to get your insulin, which is to help control your blood sugar for before breakfast. So I'm going to take your blood glucose and make sure that was all right. And it is. So you're going to get it, and your blood glucose level is within range. So do you have any questions about your meds? Nope. All right. So could you just verify your name for me? She states her name is Millie Larson. Your date of birth. She says 1/1/36. I look at her armband and everything is confirmed. Do you have any known allergies? And she says no. All right. So I'm going to draw up these meds for you right now. All right. Do you have any questions? All right. I'm just going to make sure she has enough privacy because she is going to be given the subcutaneous insulin, and she's going to get that in her abdomen. All right. Any questions at all? Millie Larson says no. So let me draw up the meds. Let me confirm what I have again. Once again, I have the furosemide, 20 milligrams. All right. Once again, it's 10 milligrams per ml. She was getting 20 milligrams. So we're going to draw up 2 mLs of this. We already checked it. going to wipe the top of this. Aspirate the air. Punch down. Gonna get the two. You have the two of that. Put that over there. We're going to label this. This is furosemide, 20 milligrams. All right. The next med that we're going to draw up, once again, to compare, we have the Lispro, which is the 10 units with the insulin. I'm going to give it subcutaneously. That's what we have here. All right. Ten units. I would also verify with another nurse to make sure that it is 10 units. Let's label that. 10 units, Lispro. Then get ready to give the patient. So the first med we're going to give, once again, is the furosemide. Let's compare it again. 20 milligrams, which I just drawn up. This is what I had labeled, so this is the correct med. This is going to be given via IV. Now with the IV, make sure that her IV is working properly. There's no redness or swelling going on with that. Seems to be working all right. And it's to be given over 2 minutes. All right, according to the order, her blood pressure was taken by the UAP. The blood pressure is within appropriate limits that she can receive her med. So I'm going to check her catheter for, her IV site for patency. Going to first clean. Let dry while it's drying. 3 cc's. Ooh, excuse me. All right. It infuses. 3 cc's given. It infuses fine. No redness, no swelling. So then next, I'm going to give, let's open another one, the furosemide over 2 minutes. going to push 2 points. All right, wait. Mrs. Larson, how are you doing today? Doing well? Okay. Push a little bit more. All right, halfway there. Push a little more. Quarter there. Three-quarters there. Okay, the last little bit I will push. Okay, the med was given over 2 minutes. Take that. For the sake of the video, I will have new alcohol pads, clean it off. All right. Flush it again. 3 cc's. All right. Put the capping device back on there. Dispose of all the garbage properly. All right. The next med I'm going to give is the Lispro. And she's supposed to get 10 units once again. This is what I have here. Let's verify. 10 units. All right, she's supposed to get this sub-Q. We've already checked her glucose, and it's within limits that she can get it. So making sure there's adequate privacy. Have Miss Larson uncover her tummy. I'm going to clean her tummy. All right, from the inside out. All right, let that dry. Have the syringe once again, and this is Lispro. She's going to receive 10 units. And we're going to go in subcutaneously. We're going to pinch the abdomen. All right, go in at a 45-degree angle. Hold it in between pointer finger and index. Go in at a 45-degree angle or 90. I like 45 degree. And administer slowly. Take out, put on the safety device. Dispose in the sharp container. Just blot, that's it. All right, put back down Mrs. Larson's shirt. Ask if she has any questions. She says no. Then make sure the core bell is within place. Dispose of my gloves and everything else in the garbage and hand sanitize. And then I'm going to document what I gave in the site. So I gave the furosemide side and the time. And the site was the sub-Q in the abdomen. Document, and that's about it. And that concludes my med administration.